Hi, my name is Deepa Halaharvi. I'm a breast cancer surgeon and also a breast cancer survivor. Welcome to OhioHealth Cancer Survivorship video lecture series. And today I will be talking about I survived cancer, now what? Dealing with survivorship issues and finding your new normal. Just an overview, we'll talk about survivorship, new normal, what that means, and to take control of your life, managing the side effects such as pain, self-image, fatigue, neuropathy, lymphedema, menopausal symptoms, fear of recurrence, obesity, and cancer. We'll also talk about lifestyle, exercise, diet, usage of alcohol, and cancer reoccurrence, and then what constitutes survivorship follow-up care plan. Survivorship starts at diagnosis. So a person becomes a survivor on the day they're diagnosed with breast cancer. And we often want to be what it was prior to cancer, before the cancer diagnosis. But it is really difficult to go back to being your old normal. And sometimes you do have to find your new normal. And I think sometimes the new normal is better than the old normal. We will look at life in a different way. We don't sweat the small stuff as we did in the past. We may worry more about the future. Now we're living with scars, not just physical, but emotional scars. And also I think if you're able to find meaning after cancer, that is also good. And some people do think of cancer as a gift. And it is okay to view cancer either negative or a positive way. But it all takes time, so you have to be patient with yourself. Some questions to think about. Should I tell the doctor about the symptoms that worry me? Which doctor should I see after treatment? How often should I see the doctor? What tests do I need to do? What can be done to relieve pain, fatigue, or other problems after treatment? Is there anything I can or should be doing to keep cancer from coming back? I'll start talking about pain. Painful scars from surgery, or pain or numbness in the hands and feet because of damaged nerves or due to chemotherapy. Wanting to control pain is not a sign of weakness, and I think that's really important for us to know that. Some people will have a lot of pain, some people will have less pain. People will often ask me how much pain I'll have after surgery, and it's hard for me to tell. It really depends on the person. And you want to keep track of the kind of pain you're having, figuring out what kind of pain. Is it sharp? Is it dull? Is it achy? What makes it better or worse? Does taking a pain medication help it? What makes it worse after you're working out? And also it's better to keep like a pain scale. How do you rate it on a scale of 0 to 10? And does the pain stop from doing your household chores or going out and having fun or just having your daily routine? I think these are the things that physicians, we would want to know and how to better help you. Coping with pain, and make sure to let your doctor know that you do have pain. It's not, again, not a sign of weakness. And some of the things the physicians can recommend for you is pain relief medications, such as mild to stronger medications, pills, sometimes patches can also help. Antidepressant medications can also help reduce numbness and pain. Physical therapy can help with heat, such as heat, cold, as also massage can help with pain. One of the things that has really been proven that works really well for pain and some other things is acupuncture. And that's something that sometimes we don't often investigate into seeing what acupuncture actually does. Some other things that can help with pain is meditation, mindfulness, and I'll talk more about that later on, which goes along with relaxation. Yoga and guided imagery, those are all the things that can help with pain. Self-image and cancer. So there's a lot of things that change about yourself after you go through the diagnosis of cancer. You may have hair loss from chemotherapy, weight gain or weight loss. You'll have scars from surgery, rash from the drugs that you have to take to deal with chemotherapy, loss of a limb or breast, or need for an ostomy if you had like colon surgery. There is a number of different ways to cope with this. Number one is you really need to talk to someone who's gone through these things before so you don't feel alone. And then some of the other coping mechanisms, you definitely can talk to a plastic surgeon. If you've had, mastectomy where you don't have a breast, they can talk to you about different reconstructive options. And women can also wear bra prosthesis where on clothing no one can tell that you don't have breasts. Cosmetic solutions, so if you're having issues from hair loss and some other things, definitely talking to someone who can help you with these things. I think just knowing that you're not alone and other people have gone through it is going to help you a lot in dealing with it. Physical and social activity helps you to focus on something other than cancer, so sort of a good mechanism of distraction. And many of these changes will resolve or improve as time passes after the treatment. So know that it's temporary. And one of the other side effects of cancer treatment is fatigue. I probably hear about fatigue from almost all my patients, and either you have it at time of the surgery or chemotherapy or radiation. But most commonly I do hear it at the time when patients are going through chemotherapy and radiation. It is the most common complaint I hear in the first year after diagnosis of cancer. It's really important to rule out some medical conditions such as anemia, thyroid problems, sleep problems, and depression. It's better to get some lab work to make sure your white count is not elevated or your hemoglobin is not low. Those things can definitely cause fatigue. And some of the ways to deal with fatigue is you really have to be purposeful in how you spend your energy. Now is really the time to let go of things that doesn't matter anymore. Plan your day, save your energy. And I think sometimes taking short naps during the day can also help. It can just be like 10 minutes at a time. Some of the other things one can investigate to deal with fatigue are massage, music therapy, yoga, and of course the mindfulness and relaxation techniques. In terms of diet, it's important to eat nutritious food, something that does not have a lot of sugar in it, which again, causes you to have that drain in your energy. Making sure you're eating a well-balanced meal with high protein, a diet, and making sure you're snacking, again, fruits and vegetables. It's also important to avoid caffeine, alcohol, or tobacco in the evening time. And it's important to keep the same sleep-wake cycles, and I think that's really important for your body to get used to the new normal. This is funny because, sometimes people will say I have a chemo brain, and what is that? Well, chemo brain is someone that goes through, it's sort of like a mental fog. A person experiences that after chemotherapy. This can happen anywhere and last for up to 3 years after chemotherapy. And basically, people will describe it such as trouble recalling names, trouble focusing or multitasking. Breast cancer, of course, affects women most commonly. Women are really good at multitasking, but now they are shocked. They've gone through chemotherapy. They're not able to do what they did in the past. And that's totally normal. Unable to finish sentences that you started, or taking longer to finish things that you once did it very quickly. Also, some things that can add to chemo brain is if you have stress, if you have anxiety and depression, those things can all affect the cognitive function. And it is seen in men or women who have gone through chemotherapy, but also in women who take anti-hormone medications. Some of the ways to cope with chemo brain is you can use a daily planner, take one task at a time and avoid distractions, and returning keys to the same time at the same place every day. Create an environment free of clutter. When you have a lot of clutter, it's really sometimes difficult to think. And Tai Chi, there's a study that looked at Tai Chi for 10 weeks, has looked at if someone who's done it twice a week for 10 weeks, it improved their immediate memory and delayed memory and executive functions. Meditation is also helpful, and of course, exercise is very beneficial. It's really important to set up and follow routines the same day, even on weekends or even when you're on vacation, and making sure rest becomes your priority. It's important to plan your next day. At the night before you go to bed, make sure you gather up your clothes, your things that you need to take with you to work. It just becomes less chaotic and less anxiety-provoking situation the next day. Some of the other ways to deal with chemo brain, word puzzles such as Sudoku is helpful. Luminosity, it's an app that you can get it for free on your phone. It has comprehensive brain training games. It improves memory, attention, flexibility, speed of processing, and problem solving. And I have used it myself, and it's really good. Neuropathy is another side effect of chemotherapy, and what it does is the chemotherapeutic agents can cause damage to the nervous system, such as Taxol or Platin agents. Symptoms are made worse if one already has diabetes, kidney failure, history of alcoholism, or malnutrition. The symptoms that patients typically tell us are like tingling and burning in the fingers and toes, feels like electric shocks through the feet and hands and feet. And it's really difficult sometimes for them to hold utensils. You want to be careful when you're cooking, and you want to wear very well-fitted shoes. Be careful with sharp objects, and especially with burns. You may or may not feel it, but you may burn yourself. Some of the medications that I've really shown to help and I've used for my patients are Neurontin, Tegretol, Effexor, and amitriptyline. And there's some other medications that you can talk to your doctor about. Physical therapy is definitely an underutilized resource for neuropathies. Acupuncture is very helpful in combating the neuropathy. It also helps with pain as well as with sleep. Lymphedema, it's swelling due to buildup of lymphatic fluids. It can occur right after surgery and radiation. We see this oftentimes if someone has to have a lymph node dissection and they have to get radiation after breast surgery. But it can happen anytime from the surgery to up to 3 years afterwards. And in the United States, it affects 3 to 5 million cancer patients. And 80 to 90% will develop lymphedema within the first 3 years of treatment. And what are some things we can do to help with lymphedema? Maintaining normal body weight is probably the most important thing to do, as increased body mass index is associated with worsening of lymphedema. Lymphatic massage by a therapist is very helpful. Exercises that they can show you can be helpful. Wearing special elastic sleeves helps with fluid drainage, lymphatic pump, as well as surgical treatments such as lymph node transfer, as well as lymphovenous bypass that's done by a surgeon in surgery if the lymphedema is pretty bad. And some things that one can do to manage lymphedema is avoiding trauma to that arm or to that leg, making sure, there is, back in the day, people would say you cannot get blood pressures in that arm or cannot get IV sticks. That's sort of a myth. We really don't have the data to prove that, that you cannot get blood pressures or needle sticks in that arm. One thing I would tell my patients is to avoid rose pruning. Sometimes that can lead to scratches and then to infection. And make sure if you have pets in your house, just be careful that they're not scratching your arm. Avoiding extreme heats is helpful. Avoiding carrying heavy bags, as we women tend to do at times. The things that have really been shown to helpful for lymphedema is exercise and weightlifting. Managing another side effect that we women often can suffer from is menopausal symptoms, and this can be as a side effect of chemotherapy or hormonal blockade. And this can manifest as irregular periods, hot flashes, vaginal dryness, loss of interest in sex, fatigue, and sleep problems. I have a lot of young women who are diagnosed with breast cancer in their 20s and 30s, and unfortunately they're entering menopause when an average age for a woman to go through menopause is 55. Now these women in their 20s and 30s are entering menopause, and there's a lot of side effects that go with it. It's important to avoid caffeine, alcohol that can lead to hot flashes, avoiding hot foods, smoking, dressing in layers where you can remove clothing. If you're going to work, maybe dressing in layers. If you get cold, put your jacket back on, but you can take it off if you don't want to. Antidepressants and acupuncture has really been shown to be helpful in women who deal with hot flashes. Obesity and cancer. So obesity is a body mass index, and it's a weight in kilograms divided by height in centimeters square. What is a normal body mass index? It is between 18.5 to 24.9. So up to about 30 is considered overweight, but over 30 we consider that to be obese, and over 40 BMI is considered to be extremely obese. Obesity is an independent risk factor for cancer, and it's responsible for 1 in 6 cancer-related deaths in the United States, not to mention heart disease and diabetes and some other medical problems. And the reason for that is, first of all, for obese women, there's 30% higher risk of cancer coming back and 50% higher risk of dying from breast cancer. And the reason for that is for a woman who's excessive adipose tissue or fatty tissue, estrogen tends to deposit in the fatty tissue, and that can make the cancer grow. And obese women also tend to have higher insulin levels than women who are not obese. And insulin can act like a growth factor and can make the cancer grow. What are some things we can do to prevent obesity? Well, it really has to be sort of become a lifestyle now moving forward. American Cancer Society recommends exercising about 150 minutes of moderate exercise every week. So that's 30 minutes 5 days a week, or a 75 minutes vigorous exercise each week. And also they recommend strength training exercises at least twice a week. And that's really helpful for women who are going through menopausal symptoms and taking anti-estrogen pills which can thin your bones. The strength training can actually help with that. One diet that has been well studied and has been shown to decrease cancer reoccurrence is a Mediterranean diet. What is that? That's a diet that includes fish, vegetables, nuts, legumes, boiled potatoes, fruits, vegetable oil, and olives. In our Western culture, we tend to eat food that's highly processed, refined grains, a lot of sugary foods. And so the Mediterranean diet is sort of the opposite of that and just incorporates lots of fruits and vegetables. And one study has noted it to have 44% decreased risk of cancer coming back for someone who's already diagnosed with cancer. So some take-home messages from all this: making sure you're eating at least 5 servings of fruits and vegetables every day. Eating plenty of fiber is beneficial for colon cancer. Now we also have studies to show it's beneficial in breast cancer. Drinking lots of fluids, 8 to 10 glasses of water every day. Avoiding salted, pickled, or smoked foods and limiting red meat. Drinking little or no alcohol. Using sunscreen is protective for skin cancer such as basal cell cancer, melanoma. Avoiding tobacco. Tobacco can cause all kinds of cancers from mouth to esophagus to stomach to colon to small bowel to pancreas to bladder cancer as well as breast cancer. And it's really important to manage stress level. That's something I do have. Sometimes I do see women when they're diagnosed with cancer, if I've asked them if they've had a stressful event in their life, they'll always talk about either they've been through divorce or someone in their family just passed away or some sort of a stressful event that they will incite. And I would have to think that definitely has a relation to cancer. So cancer reoccurrence, this is something I hear a lot about, and I'm a breast cancer survivor myself. It's something that I think about on a daily basis, especially when I'm diagnosing new cancers. It's really totally fine to think about cancer reoccurrence. It's totally normal. And really tends to happen on the day you're on the cancer anniversary day, or if you have a friend or a family member who gets diagnosed with cancer, you sort of replay the entire situation. Or if you have to get scans, that's sort of like a PTSD. It's very normal to think about that, but it's really important to have that positive self-talk to yourself. You have to become your own best friend. Maybe important to join a good support group. Exercising obviously helps with everything we've talked about so far. Meditation and mindfulness sort of calms your brain. Sleep is very important. We cannot underestimate sleep, and a healthy diet. It's important to follow up with your physicians on a regular basis. So they're doing physical exams and getting the appropriate labs and the scans that you need. And like I said earlier, it's really important to be your own best friend and give that positive talk to yourself. I've noticed for patients who have faith very strongly grounded in their faith, that helps because they know somebody else is in control and we can't always be in control of our life. And they also tend to have a happy outlook and it's important to pursue dreams and do things that bring you joy. More than ever now, you realize the importance of life. Let me talk briefly about alcohol and cancer. This is a question I get frequently, is how much alcohol can I have? And American Cancer Society recommends no more than 1 drink per day for women and no more than 2 drinks per day for men. Alcohol is linked to different cancers, including throat, liver, colon, and breast, and multiple other cancers. So it's good to have, that fun times when you go out and you're celebrating something, but it's probably not a good thing to be doing every day. Lifestyle and cancer reoccurrence, and I've talked a lot about mindfulness and meditation. There's a number of studies that have looked at this in terms of how much benefit it provides in terms of relieving anxiety and depression. Right now with COVID, I'm seeing lots of patients who come in who have a lot of anxiety in general, but I think the cancer diagnosis sort of increases that multifold. Mindfulness and meditation is something I recommend to everyone. You can do it from 5 minutes to 15 minutes to an hour. There's lots of apps, lots of things you can get on YouTube that are for free that can help you with mindfulness meditation. And it definitely does decrease the fear of reoccurrence. And I cannot say enough things about gratitude journal. This is a journal that you keep and write 5 things that are positive for that day, and you keep doing that every day. So you're feeding your brain the positive things, and so you're less worried about the negative events that are happening in your life. I like this, Dr. Seuss. I do not like cancer here or there. I do not like cancer anywhere. And again, we need to take our health into our own hands, and we need to know what symptoms and signs that we experience and when we should go see a doctor. So some changes, a new lump or thickening in the area about the collarbone, a new bone pain that's different from arthritis or fibromyalgia if you have that, chest pain associated with shortness of breath, chronic cough, persistent abdominal pain or bloating, frequent chronic headaches, dizziness, fainting or changes in vision and inability to control urine or bowels, persistent nausea, loss of appetite, unintentional weight loss. These are all the things that should be a red flag, and you should bring those up to your doctor when you see them or make an appointment to see your doctor. When one goes through a cancer diagnosis, they typically should get this survivorship care plan. We at OhioHealth give it out to our patients after the end of their treatment journey, which has a date of diagnosis of the cancer, the type of cancer, the grade and the stage, and what kinds of treatments a person received, whether it's surgery, chemotherapy, radiation, results of any diagnostic tests, and a schedule of required tests needed to evaluate your health after cancer treatments, and also risk for developing long-term side effects of cancer treatment. At OhioHealth, we are very fortunate to have a Survivorship Clinic, and it's located both at the Bing and Wilkins Grand Medical Center. This is really great in monitoring patients for fear of reoccurrence or any symptoms, and also just help them to keep the screening keep going in the future, and to diagnose any new cancers, any secondary cancers. So this is a great thing that we offer to our patients here at OhioHealth. The things that you want to ask your doctor is, how often should I return for follow-up visit? What screening tests do you recommend based on the treatments that I had? What can I do to lower the cancer coming back, the risk of cancer coming back or developing another cancer? I think one thing that's important for us to know is once you have breast cancer, you're not exempt from getting colon cancer. So it's important to doing screenings for colonoscopies, important to do screenings for skin, especially if you're out in the sun. So you cannot forget other cancers. And that's one thing that at OhioHealth, the Survivorship Clinic definitely does help with that physical exam as well as genetic counseling. And we have a number of other amazing things that our Survivorship Clinic offers. And the survivorship support services that may be available not just to you, but also to your family. That's something it's good to know. There are some links to some really good websites for a follow-up care after cancer. NCCN and MD Anderson guidelines, something that we use here at OhioHealth. Finding meaning after cancer is actually very meaningful to me as a breast cancer survivor at 5.5 years now. And it's always a question that I talk about to patients. And having cancer or going through adversity, it's not always about making lemonade out of lemons. It is about finding meaning so we have better quality of life, which enhances our psychological and physical well-being. I think once a person gets told about diagnosed with cancer, it really heightens the awareness of mortality. You do change as a person. You may feel disconnected at times, and you may also have a desire to lead a more authentic life. And it's important to know if this is meaningful to you or not. And if it is meaningful to you, hopefully that is very empowering to you. And some people want to make a change or leave a legacy after they are gone. If you've never read the book, Man's Search for Meaning, it's by Viktor Frankl. He was in the World War II at the Nazi concentration camp. He's a psychologist by training, and he witnessed a number of people who have extensive physical, emotional, psychological suffering in this camp. And what he noted is the people who actually found meaning in their suffering were the happiest. And what he said was the attitude in these people who were in this Nazi concentration camp that made a huge difference. So for us, as we go through life, whether it's cancer or any sort of adversity that we encounter, I think our attitude is something we always have control of, even though we don't have the control of the situation we are in currently. And I really love his quote, "Everything can be taken from a man, but for one thing, the last of the human freedoms, to choose one's own attitude in any given set of circumstances is to choose one's own way." And for me, it's very empowering to know that you always have control of your attitude, regardless of the situation, even though we may not have control over that. Happiness without meaning characterizes a relatively shallow, self-absorbed, or even selfish life in which things may go well. Needs and desires are easily satisfied, and difficult or taxing entanglements are avoided. I think we can be happy without finding meaning. And for people who've gone through negative events or circumstances, when they can find meaning out of those events, that definitely does lead to more happiness, and that's more purposeful and meaningful. Thank you from a breast cancer survivor. Regardless of any adversity, cancer diagnosis or prognosis, never give up or never give in. And thank you for attending the Cancer Survivorship video lecture series.